Okay, welcome back. And again, thanks for joining me for today's webinar. The topic today is on how to treat post-workout recovery, which is really delayed onset muscle soreness. I'm sure everyone's experienced that, specifically with using the BIOFLEX Personal Therapy System. My name is Dr. David Kanashko. I'm a chiropractor and the medical director at BIOFLEX Laser Therapy, based here in Toronto, Ontario, Canada. As per usual, these webinars are recorded, then they're edited, and then they're uploaded onto our website. So if you missed it or you want to watch previous webinars, just go to bioflexlaser.com, look at the top for support, and you'll see past personal therapy webinars archive, and then you can check those out if you'd like. So I'm going to do a little bit of an introduction and then talk just a bit more detail about what DOMS is, or delayed onset muscle soreness. And then I'll talk a little bit about how light therapy or red light therapy or photobiomodulation, however you want to call it, can be very helpful in both reducing the symptoms and helping with your recovery, afterwards. And then specifically, well, I'll talk a little bit of, there's some research, actually, there's tons of research, but just a couple of papers I want to present, and then how you would use the system to treat. And as per usual, if you have any questions as we go along, just type them in through the Q&A box. And if you're so inclined, it would be great to let us know your name and where you're listening from. Would be always a nice little gesture if you can do that. So I'm sure everyone's kind of familiar. If not, the systems look something like this. There's a light pad. Our equipment has two types of wavelengths, red and near infrared, coming out of the same diode. So these are called bicolor superluminous diodes, and that's the core of the treatment regime. The whole concept of light therapy is that light will penetrate into the tissue, so the pad touches the skin, and red light can go a certain depth, and near infrared goes actually quite a lot deeper. It's actually the near infrared that I'm going to focus on today more so when you're treating DOMS, because that's the light that's going to get into the muscle tissue much more effectively. The controller looks something like this, different areas of the body and protocols to choose from, power and stop, pause and start, and then selecting an intensity stage. They're pretty straightforward. Specifically, you do need to be familiar with the treatment stage, so I'm going to recommend what to use, as well as what area to use for this type of treatment, and these other buttons, which again are pretty self-explanatory. So during my research for this particular webinar, and this is according to the American College of Sports Medicine, that really any type of activity that places unaccustomed loads on muscle may lead to delayed onset muscle soreness. That's really the key, because usually you don't get it just, doing a regular walk or that kind of thing, unless you haven't done a walk for a long time. It's more like weekend warriors, or you haven't done a certain type of activity before for a long time, where you're doing certain things that stress the muscles in a way that they're not used to. And this could be weightlifting, for example, right? But this can be from other sports and activities as well. And we all know that the next day you wake up and go, oh my God, I'm so sore. You might get a massage or just rest or whatever. And it lasts about, a couple days or so. Certainly it's gone within a week. That's DOMS. And it's important to understand what this is. But the main issue I'm talking about today is really how to reduce those symptoms that you feel so that you can get back to the activity again. Because what happens is we get DOMS and then say, oh, I don't want to do anything for the next couple of 3 days, right? So it's not really a great thing per se, or at least you want to limit it so you can continue to train and be active. So just a little review, like some of you may or may not be familiar with what muscle tissue kind of looks like. If you're looking at a muscle, you can see here at the sort of top of the screen, top right, that's a bundled muscle fibers. And, it's there's a whole bunch of subsequent muscle fiber cells that form sort of fascicles or bundles. And then they're broken down. Each muscle fiber cell is broken down into even smaller units called myofibrils. And you can see here in the top left, you don't need to really know this, but it's kind of cool. And these are the contractile components of muscle fibers. They actually intertwine, kind of like how my fingers are sticking in like this. And then they kind of go in and out like this. And that's what causes the contraction and then movement of your muscles. So this is really what we're dealing with. We're dealing with muscle fiber cells, and they get what's called ultra structural damage, not a muscle tear. Like, so this is different than, going for a run and straining a muscle, right? That's not what we're talking about, because that takes much longer to recover from. This is actually structural damage inside the muscle fiber without it tearing. So I'll kind of explain that as we go along. So essentially, what's happening here is that you do a form of exercise, usually one that you haven't done in a while, or especially what's called eccentric loading, and I'll talk a little bit about that, causes some tissue damage. And when you have this tissue damage, this cellular tissue damage, you get release of chemicals that irritate pain nerve fibers, and this causes the pain. And then it also leads to some subsequent inflammation as well. So that's really what's going on after you do an exercise, the kind of scenario where you start to get this delayed onset muscle soreness. This is really a detailed version of that, which I'm not going to spend a lot of time on, but essentially what happens is, if you look top left, unaccustomed, what's called eccentric exercise, and this causes exercise-induced muscle damage. And then what happens is you get all sorts of stuff, right? You get leakage of proteins, you get leakage of calcium, you get an increase in what's called ROS, or reactive oxygen species. And these all irritate the nociceptors, which are pain fibers. They're called A delta and C fibers, and that's kind of what leads to your pain. But then along the way, you start to get this response to the damage, and it's a pro-inflammatory response. You get neutrophils, kind of white blood cell, and they start to release pro-inflammatory chemicals called cytokines. And this is what causes the pain and the inflammation. And then what happens over the next day or two, as you get better, you start to get macrophages. It's called an M2 phenotype macrophage. Again, don't worry, there's no test at the end of this, but these macrophages calm everything down. They do the opposite of what the neutrophils are trying to do. They actually promote repair and regeneration, help you recover, and growth factors, and that's what you want. You want this anti-inflammatory response as soon as possible. Otherwise, you're going to be sore for a few days and you're just not going to want to do anything. And that's not really the goal of exercise, right? The goal of exercise is to do it pretty much most days or every day, right? You want to be active, right? So it's definitely pretty complicated on that level, but again, we don't need to know that level. So what really happens is in DOMS, right, is there's this type of ultrastructural muscle injury. And again, as I mentioned earlier, it's usually caused by eccentric or unfamiliar forms of exercise. It's usually a combination of high force and reduced recruitment of fibers during eccentric contractions, and it leads to a high mechanical stress of a certain type of muscle fiber. So first of all, let me explain the different types of movements that I'm sure we're all familiar with. Sorry, I'm coughing a bit. So we're familiar with concentric movement. So that's like you take a bicep or a bicep curl and you bring that weight towards your shoulder, right? That's concentric. Isometric, whoops, let me back up a bit there. Isometric is if you're holding a barbell and there's no movement involved, but your muscles contracted to hold in that position. That's isometric, which is a great way to strengthen muscles without really creating any damage. But that's something for another story. And then there's eccentric movement. So you've done your bicep curls, and now against gravity, you're slowly letting that weight back down into neutral position. And actually, that's pretty much the proper way of doing a lot of weight training is you want to do both concentric and eccentric contraction. They have benefits in the muscle tissue when you're doing that. So during eccentric exercise, the external load can be greater than the force generated by the muscle fibers. And so essentially this can lead to some damage. So there's a few different types of muscle fiber cells. There's slow twitch fibers. You may have heard of this before. So obviously it's more of a postural kind of muscle. It's pretty much resistant to fatigue. So kind of think like this. Right now, if you're sitting up, your head's, in a position, it's there because muscles are keeping in that position. Right? These are the slow type 1 fibers, right? You can do it for a long time, right? So it's best suited for, postural stuff or like really long endurance kinds of exercises, that kind of scenario. But then we have fast twitch fibers. There's two types, type 2A and 2B. Regardless, is that their speed of contraction is much faster. But they fatigue a lot faster as well too. And these are the kinds of things that you use for like, fast walking or sprinting or moderate to high reps of strength training. And then the type 2B or the kind of super fast muscles, they fatigue really quickly. Kind of think of this as if you're trying to do pull-ups, you do like 2, 3, 4, 5, or 20, whatever you can do. I can't do one. And then it's like, oh, I can't do anymore. That's the fast 2B, fast 2 type B twitch fibers, right? So that's what we're talking about here. So during eccentric exercise, predominantly fast twitch motor units are recruited. So when you're letting that barbell down, it's the fast twitch that are being recruited to do that. Unfortunately, these fibers are much more easily damaged than the more endurance type 1 fibers. So this is kind of the potential injury mechanism here, is that the eccentric is loading up these fast twitch fibers and the force is almost too great for them to bear. And then it starts to lead to some damage, not tearing of the muscle fiber cell, but ultrastructural damage, the myosin and actin and kind of even perhaps some collagen and stuff inside these muscle fiber cells. So when they've done like biopsies of these lesions, what they found is that, it's these lesions that can lead to this inflammation and potentially even damage the cell irreparably, but not all the time. I mean, it can do that for sure. I mean, DOMS itself is considered a mild type of muscle damage, but it is obviously the most common reason for post-workout discomfort. The thing that you should be aware of when you're, and I see some questions there, I'll get to those for sure at the end of the webinar. Understand the difference between DOMS and a muscle tear or strain. DOMS, pretty much, you feel okay after your workout and you feel pretty good and energized and all that. And then as the day progresses, you start to feel a little bit achy or sore. The next day you're like, holy crap, like what did I just do? That's DOMS. Muscle strain, you feel it right away, right? Like you're going for a run and you go, oh no, my calf, you just strained a muscle, right? That's different, okay? So achy, stiff pain with DOMS, sharp, more localized pain with a muscle strain or tear, more kind of generalized pain with DOMS. You tend not to have any bruising, right? But with a muscle strain, you'll oftentimes get what's called ecchymosis or bruising, so purplish color afterwards, like you got true damage there. That recovery takes much longer. So the signs of DOMS are pretty variable depending on person to person and what kind of exercise you're doing. It can be, fairly severe. It can be fairly mild, but it usually does knock you out, as this cat is showing you here. So the prevention and treatment of DOMS, implying the recovery from exercise-induced muscle damage, it's an integral part of regaining muscular force capacities and performance levels. So in other words, you do want a little bit of soreness and stiffness when you're working out and doing like, especially strength training, but you don't want it excessive, and you want it to go away as fast as possible, right? So that's kind of what we're talking about here. And DOMS, the earliest manifestations, as I mentioned earlier, a few hours, 6, 12 hours post-exercise. And this is, again, is caused by the damage. And then it kind of reaches this peak within a couple of days, 2, 3 days is when you're feeling the worst, and then it starts to get a lot better. And usually within a week, and that's variable, but usually you're pretty good after a week. But that whole week, you could be like, oh man, I can't do anything now. And that's not good, right? So we want to try and reduce that, the severity and the amount, and how much, well, hopefully quicker you can recover and repair this tissue damage. One thing you should also know, you may or may not know, that muscle fibers can repair themselves, and they use something called a satellite cell, sometimes called a reserve cell. It's kind of like a stem cell. These are quiescent cells, so they kind of like, they're quiet, they're napping, they're attached to your muscle fiber cells. And when you have ultrastructural damage or a muscle strain, a tear, they get activated. When they get activated, they can actually turn into new muscle fiber cells or repair the damaged cells that have been damaged due to, say, DOMS. So these satellite cells are really important. And light therapy, by the way, has been shown to increase, I think, 4 to 5-fold the number of active satellite cells on muscle fibers when you irradiate them with light. So you have a greater capacity to repair because of more satellite cells when you irradiate your muscle fibers with near infrared or red infrared light. So red light therapy, again, that's a kind of not a great name, but that's what everyone knows it as. After physical exercise can help improve muscular metabolic function, and it can help repair these micro lesions that are caused by the mechanical and metabolic stress after your exercise. There's quite a few theories and mechanisms of how this light therapy can work. But really what you just need to understand is that the light needs to penetrate. So this is a kind of a schematic diagram of a cell, any cell, and the light, which is a squiggly red light, it gets into the mitochondria of the muscle fibers in this case, and then it helps improve the metabolism. So it gives it more energy by producing more ATP. It releases nitric oxide into the blood that causes increased microcirculation. So it helps to clear out some of the lactic acid, that kind of stuff. So that's kind of the benefit of what red light therapy is doing. There's tons of research on this. This is just one particular paper. I brought it up because Michael Hamlin is probably the world-renowned expert on photobiomodulation. He's kind of retired now. He's quite elderly, but he's published, I don't know, hundreds and hundreds and hundreds of papers on photobiomodulation therapy. He actually once or twice spoke at our big seminars and master classes in the past, so I've had a chance to chat with him. This study looked at 46 research papers, about 1,000 people, and they used everything from similar to what BIOFLEX uses, like flexible LED arrays to LED clusters to laser diodes. So they use different types of light sources, and they use both near infrared and red. And what they found was that photobiomodulation can increase muscle mass gained after training and decrease inflammation and oxidative stress in muscle biopsies. And what's really interesting is that they raised the question that should this be legal or not legal in the case of international regulatory sport? So in other words, right now, it's not illegal, and it's probably pretty hard to tell if an athlete uses this just before a sporting event. And they probably would gain an advantage if they did this. I'd be highly surprised if a lot of athletes aren't doing this, but because it's pretty well known now that can help performance and performance recovery. When you think about like soccer players, where they're running and have all sorts of, muscular strain on their body, and then they have to go out and do all that again in another few days, right? So they want to recover as fast as possible. So really, as I mentioned earlier, photobiomodulation works on the mitochondria in the cell, and it can lead to a whole host of benefits inside that cell. Really, the net result of all this is increased energy or respiration rate, ATP, inside the muscle fiber cells. What they found is that research in both humans and experimental models have found that You get better formation of new myofibrils. This is the internal component of muscle cells. And the contractile characteristics can return to the site of injury when it's repaired. It promotes a greater maturation of these young myofibrils. So I'm talking about what the benefits of light therapy do here. It increased the number, I mentioned this earlier, and activation of those satellite cells that help to repair. It can increase angiogenesis, which is blood formation. It can actually help modulate and improve collagen formation, reduce inflammation. I mentioned about ATP synthesis as well. So there really are two main strategies when you want to use light therapy for exercise recovery. One is doing it before your activity. There's lots of research on this, and they've kind of narrowed it down. It's probably best to do it a few hours before your activity. This is called preconditioning protocol, and you can do this anywhere from 3 to 6 hours before your exercise. And this can increase the performance, reduce muscle damage, and prevent pain developing as high as it would if you didn't treat it during your exercise. And a second strategy, so you can combine these strategies, is to use light therapy immediately after your exercise in order to accelerate muscle recovery. So the use of light therapy after each training exercise seems to increase potential gains in performance, including defense against oxidative stress and muscle cell proliferation, and again, increasing glycogen and ATP and mitochondrial metabolism. So here are some things that you should be doing already in conjunction, even if you're not doing light therapy for exercise. You need to warm up your muscle tissue, right? I've talked about this before in the past, where you do different exercises. You know, it could be on a bicycle, it could be running back and forth, side to side. Just engage your muscles, get the blood flowing. That's really important. And this just helps to kind of clear out waste products and get the blood flowing to your muscles. After an exercise, having a massage is helpful, or just getting a foam roller for yourself and going over the muscle tissue. This can help improve blood flow, even promote tissue healing and reducing pain. You do want to make sure you're hydrated, not just during your exercise, but during the whole day. This again helps with optimal tissue recovery. So that's really important as well. There's a bit of research out there about ice. You've heard all about ice plunges and everything. I don't think it's as great as they make it out to be, but there are some mild benefits. It might be helpful for pain reduction, and even ingesting caffeine before exercise have been shown to reduce delayed onset muscle soreness as well. So in order to accelerate muscle tissue healing and reduction of inflammation and overall muscle recovery, I'm going to recommend that you, if possible, treat before and after. Now, it may say, oh my God, it's going to take too much time. Actually, it doesn't. And I'm going to talk about how long you should do it and how you should do it. So again, a few hours before your activity, I'd like you to treat the main muscle groups. So if you're going for a run, treat your quads, your calves, and maybe your hamstring, maybe your gluteal muscles, that kind of scenario. If you're out and going to play tennis, maybe you want to also include your arms, or whatever it is, just whatever muscle groups you're going to be mainly using is what you want to treat. And then after you've treated after your exercise as well, so anywhere up to a few hours after the activity, the sooner the better. And then every day for a few days until you're feeling much better. So that will really help. The protocol I'm going to recommend is just choosing a shoulder protocol. And the reason for this is that it has a dosage that I think is quite good, but I don't want you to use the whole shoulder protocol. So I'm going to walk you through how to do that. So you're going to click on the unit, click on shoulder, right? And then you're going to turn the pad on. So you're going to start it, but you're not going to apply it. You're going to let the red light, so it's going to glow red, allow that to finish through 6 minutes. Then you'll hear a beep, a short pause. At that point, you're just going to pause the treatment. So it's ready for near infrared. Remember, near infrared is invisible, right? Then you're going to apply it over the muscle group, the near infrared, I'm going to show you how long on those muscle groups that you're going to use or the ones that you've used post-recovery. The research basically has shown that the optimal dosage of joules of energy is 30 to 60 over the muscle groups. And the optimal wavelength is probably near infrared, so a 3840 nanometers. So that's why I'm recommending to use the near infrared. You can use the red as well, but to be honest, it's not going to really go into the muscles very well. Use the near infrared. And then we have two types of pads. We have a P120 and a P180. 120 is smaller than the 180, and the 180 also has slightly more power. So if you have the P120, that's the white pad, choose shoulder, choose level 1, and that's roughly at 60% power that it can output. You might go, well, why not choose 100% power? I wanted on 60% power because it gives you a little bit extra time. But you only need to have it on the muscle tissue for 30 to 70 seconds with a P120. And then just move it to the next section, and the next section, and the next section. You have about 8 minutes to work with. So you could probably do 6 to 8 areas before you have to rejig it, right? So once again, choose a shoulder protocol, run the red, pause it, and then place it, say, on your quads, put it on there for about 30, 40, 50, 60 seconds, then slide it to the next spot, and the next spot, the next spot until you've covered that whole muscle group. Okay, that's going to take, for a quad, that's going to take maybe around, I'm going to say maybe 3-4 minutes, and then move it to the other quad. So another 3 or 4 minutes. So now you're around 6 to 8 minutes. If you do the hamstrings, then similarly, another 6 to 8 minutes for both hamstrings. So you're looking at the whole thigh of maybe 12 to 16 minutes total. So it's not that bad. If you have P180, it's even shorter, 20 to 40 seconds on each spot. That gives you around 30 to 60 joules of energy over that area. Okay, so I mean, pretty straightforward, right? It's not rocket science, but you will notice a difference if you do this when you're doing your activity. Next webinar is on veterinary applications. I've done some in the past, but we actually have a distributor for veterinary equipment. And I'm going to be presenting this in conjunction with our distributor because they have an outreach to veterinarians and so forth. So you're welcome to join in for that webinar as well. Let me just see if you have any questions here. Whoops. Having a hard time finding my questions. Sorry, just bear with me here. Well, for some reason, I cannot load the questions today. My apologies. I don't know what happened. I've lost my my bar and it won't come back up. Let me just keep seeing here what I can do. Sorry. Unfortunately, I don't have access to the questions today. So you can always email me. Happy to answer those at david@bioflexlaser.com. Hopefully you enjoyed today's webinar and we'll chat soon. Thanks so much. Oh, no, here they are. What happened there? Okay, so let me just see here. Okay, so finally got them. The questions. Why can't I pull up the questions? Oh, it's not working. My apologies. All right, take care, everyone. Bye now.